It's actually incredibly easy to take the magic of the modern world completely for granted.
Oh, absolutely. We do it all the time.
Right. Like you wake up with a weird rash, or maybe you're just feeling, completely overwhelmed by life, and you just tap a piece of glass in your pocket,
Mm.
and boom.
Suddenly, you're face to face with a healthcare professional on a high-definition video call.
Exactly. Frictionless. That is the perfect word for how it feels on our end.
Just data floating through the air, instantly connecting a patient in need to a provider who can help.
Right. But beneath that smooth, glowing screen, there is an absolute labyrinth of invisible plumbing. I mean, the contracts, the complex billing codes, the massive shifts in corporate strategy that actually make that simple tap on your phone possible.
It's a lot messier than the app makes it look.
So much messier.
Yeah.
And today, we are going to look at the blueprints for that plumbing. Welcome to today's deep dive. We've got a really fascinating stack of raw transcripts today from a very recent corporate Q&A session. This is dated right around today, actually, July 4, 2026.
Right. And this features the leadership of a massive virtual healthcare and mental health company.
Yes, specifically, we're looking at insights from their CEO, Chuck DeVita, and one of their top executives, Mike Machek.
Earnings calls and analyst Q&As can sometimes seem like just a wall of dry financial jargon.
Oh, totally. They can put you to sleep.
Right, but this specific session is a treasure trove if you know what to look for. The overarching theme of these documents is, well, it's consolidation and adaptation.
Yeah.
This transcript reveals the exact mechanics of how a healthcare giant pivots and completely rewires the experience of going to the doctor when the macro environment shifts beneath its feet.
It is the ultimate peek behind the curtain. Okay, let's unpack this. I want to start with a massive structural shift happening in their integrated care division.
Okay, yeah, let's dive into that.
So this is the side of the business handling general virtual medical visits, right? Like when you have a sinus infection. According to the CEO, just a few years ago, the company's membership was heavily weighted toward predictable, recurring subscriptions.
Which is usually what you want, right?
Exactly. 70% of their membership was subscription-based, and only 30% was visit-based. But the CEO notes that by the end of 2026, that ratio is going to completely flip.
Wait, flip entirely?
Entirely. 70% visit-based, 30% subscription-based.
Wow. I mean, that is a total inversion of their core revenue model, executed in a remarkably short amount of time.
Yeah, to put that in perspective for you, it's like a massive corporate gym realizing that people, they no longer want the $100 monthly all-access pass. Instead, they prefer to pay $15 just for this specific spin class they actually attend.
It's a huge gamble.
But wait, I have to push back on this strategy, because in the business world, isn't recurring subscription revenue the absolute holy grail?
Usually, yes. Wall Street loves subscriptions because they're predictable.
Right. You can model your cash flow for the next 5 years. So why on earth is the CEO calling this massive shift away from stable subscriptions and toward unpredictable, a la carte, visit-based revenue, and I quote, net tailwind for the back half of the year?
It sounds counterintuitive, right?
Yeah.
But to understand why a business would voluntarily walk away from subscription dominance, you have to look at how the actual product of virtual care has evolved.
Okay, how so?
While subscriptions offer predictability, sure, but visit-based models in this new era of virtual care allow for much deeper, more aggressive monetization per interaction.
Right.
The service isn't just a simple, isolated video chat anymore. The company has rolled out new innovations like what they call their Enhanced 24/7 Care product.
Enhanced 247 care. Got it.
Yeah. So in a visit-based model, every single time a patient logs on, it's a fresh opportunity to provide a highly specific, billable service that might have previously required a costly, separate specialist referral in the physical world.
Oh, I see. And the executives noted this strategy is actually already showing up in the financials, right?
Yeah. Yes, exactly. Mike Machek, the executive on the call, detailed a very strong first quarter financial beat.
But he used a lot of technical phrasing here, which I want to clarify. He noted that about a third of that beat was due to timing and non-recurring factors. He specifically mentioned a pulled forward booking that benefited the first quarter but won't recur in the second. Let's break that down.
Sure.
A pulled forward booking essentially means a massive corporate client paid their annual invoice early, right? Like cutting a check in March instead of April.
That is exactly what happens. And it makes the first quarter look artificially brilliant, but it leaves a bit of a hole in the second quarter because the money was already recognized.
Right. The money's already in the bank.
Yeah. He also mentioned a few contract implementations that shifted to the second half of the year, meaning, the bureaucratic setup just took longer than expected, and they saw a slightly lower negative impact from foreign exchange rates or FX.
Meaning the fluctuating value of the US dollar against international currencies didn't hurt their overseas revenue quite as badly as they modeled.
Exactly. But even when you strip away those one-time accounting benefits and currency fluctuations, which amounted to a few $1 million, the sequential progression of their core business is very, very strong.
Yeah.
And that brings us right back to the mechanism of why individual visits are so incredibly valuable now.
Right, because it changes the fundamental relationship with you, the patient.
Yeah.
When you log on for a virtual visit today, the platform isn't just checking a box to say they provided a doctor.
No, not at all.
They are actively using that specific visit as what they call an activation point.
And this is key. During an activation port visit, the provider isn't just looking at your immediate symptom, they are analyzing your broader profile.
Like looking at the whole picture.
Right. So you might log on complaining of, say, fatigue, and the system flags that you haven't had blood work in 3 years. Right in that moment, the provider connects you to other services within their ecosystem.
The transcript specifically mentions integrating these visits with a recent acquisition called Catapult, right?
Yes, Catapult.
So instead of a simple $40 virtual consultation, the doctor clicks a button, activates a Catapult at-home testing kit, or maybe a chronic care module, and suddenly that single visit generates $200 of value across the company's ecosystem.
Exactly. They are turning a single point of contact into a multi-service pipeline. The visit itself basically becomes the top of a new sales funnel.
That is wild. And that structural change in the integrated care division leads perfectly into what is happening over in their mental health division, BetterHelp.
Yeah, this is where it gets really interesting.
Because if the medical side is fundamentally changing how they bill for services to capture more value, the therapy side is completely changing who pays the bill.
It is arguably the most consequential strategic pivot discussed in the entire transcript.
Okay, so the CEO was discussing their direct-to-consumer cash pay funnel for BetterHelp therapy. Historically, people would go to the site, fill out the lengthy intake questionnaire, get matched with a therapist, and then over 80% of them dropped off and never became active users.
80%.
80%. We were talking about people who are actively seeking mental health support. But when they are asked to pull out a credit card and pay out of pocket, 8 out of 10 just walk away.
It really highlights a massive, painful gap between the societal demand for mental health services and the financial reality of accessing them.
Yeah.
And the company's strategic pivot to solve this drop-off rate is incredibly aggressive. They acquired a company called Uplift to serve as the structural plumbing.
What does Uplift actually do?
So Uplift provides the back-end infrastructure required to process complex medical claims. This allows the platform to make a massive push into accepting traditional health insurance.
Which is huge.
Huge. The CEO actually projects that in the U.S., this new insurance business will eventually surpass the entire legacy consumer cash pay business by 2027.
The numbers they are throwing around to back this up are just staggering.
All right.
They are projecting an exit rate of $125 million in insurance revenue by the end of 2026. And that is scaling up from absolute zero in the middle of 2025. You combine that mental health insurance revenue with the $140 million in integrated medical care, and they are becoming an absolute juggernaut.
They really are.
But, as someone who loves looking at business strategy, I have a pointed question here. If you are a premium brand selling high-margin services directly to consumers, and suddenly you allow people to access those exact same services for, like, a $20 insurance copay, aren't you cannibalizing your own highly lucrative business? Why buy the cow if insurance gives you the milk for a copay?
What's fascinating here is that the Wall Street analysts on the call asked that exact same question.
Oh, really?
Yeah, they wanted to know if affluent people who would have happily paid cash are now just using their insurance, essentially eating into the company's profit margin.
Makes sense to ask.
But the CEO had very specific data to address this fear. He admitted there is absolutely some cannibalization risk. That is just the cost of doing business.
Right.
But net of that risk, the states where the insurance option is already live are seeing about an 800 basis point lift in revenue compared to states that are still cash pay only.
Wait, 800 basis points. So essentially an 8% overall improvement in revenue just by turning the insurance spigot on.
Exactly. The math comes down to volume completely overwhelming the loss of margin.
Right, because of that 80% drop-off.
Yes. Yes, they might make less pure profit per individual session when billing an insurance company compared to charging a credit card directly. But by removing the out-of-pocket cost barrier, they capture that massive pool of users, those 8 out of 10 people who were previously abandoning the funnel.
That makes total sense. Higher conversion rates and a drastically higher number of recurring therapy sessions per user completely outweigh the cannibalized cash margins.
Exactly. It's a numbers game.
Okay, so the demand is clearly there, the insurance floodgates are wide open, and the revenue math works. But resolving the financial bottleneck creates an immediate, severe physical bottleneck.
Yep, the supply side.
Right. If you suddenly have hundreds of thousands of new insured patients flooding the platform, who is actually going to sit on the other side of the screen and talk to them?
Right. This requires a transition from understanding the demand side to understanding the supply side of virtual healthcare. And in medicine, the supply chain is notoriously rigid.
Because healthcare is not a software product.
Mhm.
Out of the company's massive existing network of 30,000 therapists currently handling the consumer cash pay business, the CEO noted that only 6,000 have been credentialed and enrolled for the new insurance offering so far.
Only 6,000 out of 30,000.
Yeah,
Because you can't just write a line of code and scale medical capacity infinitely overnight the way you can with server space. Healthcare requires highly trained, credentialed, empathetic human labor.
exactly.
And navigating the bureaucracy to get those humans credentialed for insurance is the primary gating factor. I mean, the main bottlenecks strangling this company's growth right now.
Okay, here's where it gets really interesting. Think about it like building the world's biggest, most popular ride-sharing app, but suddenly realizing that half your drivers flat out refuse to pick up passengers going to the airport.
Oh, that's a great way to put it.
Right. You have millions of people demanding airport rides. The app works perfectly, but you cannot force your independent contractors to take the route. You have to recruit a completely new fleet of drivers specifically dedicated to the airport.
That analogy perfectly illustrates the administrative nightmare of modern medicine. Dealing with insurance companies is a massive friction point for independent healthcare providers.
It's awful.
To get credentialed, a therapist has to submit endless documentation, verifying their education, pass background checks, navigate different labyrinthine portals for different insurance networks, and then wait months for approval.
And then the fun really begins.
Right, because after all that, they have to deal with complex billing codes and the constant threat of claim denials. Many of those 30,000 cash pay therapists simply do not want to participate in that system.
And who could blame them?
Exactly. Therefore, the company isn't just trying to convert their existing network. They're being forced to act like a massive recruiting agency, aggressively hunting for brand new providers, specifically willing to work on the insurance side.
Which brings this right back to you, the listener. If you've ever tried to book a virtual therapy appointment or a telehealth medical visit, and you've been frustrated by a sudden 2-week wait time on an app that promises instant care, this is why.
Yep, it's not the tech.
Right, the servers hosting the video call are running just fine. The bottleneck is the meticulous, agonizingly slow, real-world process of recruiting, vetting, and credentialing human experts into a heavily regulated insurance framework.
Scaling human empathy is really slow, friction-heavy work. And, that administrative burden isn't isolated to just the providers or the patients. No, the massive corporate employers who are footing the bill for all this healthcare are drowning in that exact same friction.
Oh, right. The transcripts revealed a lot about how health plans and HR departments are managing the physical health of their employees, specifically when it comes to chronic care.
Yeah, and the critical phrase the executives use to describe the corporate mood right now is point solution fatigue.
Point solution fatigue. That perfectly captures the current era of digital health.
Doesn't it?
It means HR departments are struggling with skyrocketing overall medical costs, but they're also completely exhausted from having to manage a dozen isolated, disconnected apps for a dozen different ailments.
Yeah, you have a contract with an app for diabetes management, a separate contract with an app for hypertension, a totally different vendor for employee weight loss.
It's just too much. The administrative overhead of managing all those disparate systems is breaking them.
It is an unsustainable way to manage population health, and the company's strategic response to this employer fatigue is heavy consolidation.
Bringing it all together.
Exactly. The CEO noted that 70% of their chronic care offerings are now sold as bundled products. They're deliberately killing off the single-issue app model and moving toward a population-oriented view.
Okay, so by taking all their various clinical services and layering proprietary data and AI over the top, they can offer massive employers a single, unified, easily managed package.
Yes, a one-stop shop to cure the administrative headache.
But speaking of single issues, I have to zero in on the most buzzed about medical topic right now, which dominated a significant portion of this Q&A.
I think I know where you're going with this.
Oh, you do?
Right.
GLP-1 weight loss drugs.
Oh, yeah.
The analyst specifically grilled the CEO about this. They wanted to know how this giant virtual platform is handling the absolute wild west of weight loss prescribing.
Well, if we connect this to the bigger picture, the way the company is handling the GLP-1 craze is a masterclass in risk management.
How so?
The CEO explicitly stated that their posture is intentionally focused on comprehensive patient care and long-term outcomes. They are not focused on simply dispensing the medication.
Ah, so they are actively trying to avoid the reputation of being a digital pill mill.
Exactly. Employers are terrified of GLP-1s right now because an employee simply logging on, getting a quick prescription, and taking a $1,000 a month drug indefinitely without changing their lifestyle, that will absolutely bankrupt a corporate health fund.
Yeah, I mean, that's a nightmare for HR.
Right. So to prevent that scenario and secure those employer contracts, the virtual platform is proving their value by wrapping the prescription inside their bundled clinical services. They require the patient to actually engage with the ecosystem.
So mechanically, if you log on to this app seeking a GLP-1, you don't just chat with a doctor for 5 minutes and get a script sent to your pharmacy.
It's way more involved.
The system enrolls you in a metabolic program, right?
Yes, right.
You might have to consult with a registered dietitian, log your meals in the app, track your exercise, and demonstrate a genuine commitment to lifestyle changes.
Yes, and the AI monitors that compliance. Only then does the physician authorize the prescription. Furthermore, they mention strategic supply chain arrangements they've made with companies like Gift Health and Lilly.
Which closes the loop. They don't just write the prescription and leave you to hunt down the drug during a national shortage.
Right, because that's another huge friction point right now.
Exactly. The integration with Gift Health handles the complex pharmacy logistics, shipping the medication directly to the patient. So by controlling the dietary tracking, the doctor visits, and the actual fulfillment of the drug, they prove to the people holding the purse strings that they are a comprehensive, outcome-driven management system, not just a vending machine.
It is a massive jigsaw puzzle of clinical care, supply chain logistics, and insurance infrastructure, and they are forcing all the pieces to interlock.
We have covered a vast amount of ground today.
Well,
Let's do a quick recap.
sounds good.
We've looked at the blueprints of how a virtual care giant is not just surviving, but actively rewiring its machinery in 2026. We saw the structural flip away from subscriptions toward visit-based integrated care to maximize those lucrative patient activation points. We explored the mechanics of unlocking a massive, previously untapped mental health market by integrating Uplift and finally taking insurance, even as the company frantically acts as a recruiting agency to find the credentialed therapists needed to meet that new demand.
The supply chain of empathy.
Exactly. And finally, we saw how they are utilizing AI and supply chain partnerships to bundle chronic care and tightly manage GLP-1 prescriptions, curing the point solution fatigue plaguing massive employers.
It's a completely new landscape.
So what does this all actually mean for you? All of this high-level corporate strategy, the credentialing bottlenecks, the mix-shift billing models, the strategic acquisitions, it all translates directly to what you experience when you tap that piece of glass in your pocket.
Yeah.
You are looking at a future dominated by highly consolidated, insurance-backed, all-in-one digital clinic that wants to seamlessly manage every single aspect of your health in one centralized place.
Which, raises an important question, and it's something worth dwelling on long after this deep dive ends. We are watching the aggressive, heavily capitalized assembly of a comprehensive end-to-end healthcare ecosystem. If these massive virtual platforms successfully bundle our mental health, our urgent care, our long-term weight management, and our pharmacy fulfillment into one seamless, AI-driven, insurance-covered application, what happens to the independent private practice doctor?
Oh, wow.
Right. Are we rapidly moving toward a future where the solo healthcare provider is entirely absorbed by a few digital monoliths?
A completely consolidated future where the independent clinic simply cannot compete with the infrastructure of the platform. It really makes you think about who or what is ultimately controlling the ecosystem on the other side of that screen.
It definitely does.
Well, thank you so much for joining us for this deep dive. Next time you tap your phone to talk to a doctor, remember all that invisible plumbing moving beneath the surface. Keep questioning the systems that run your world, and we will catch you next time.